This video describes the irrigating goniectomy with the TrabEx by MST. So we start things off as we normally do with a side port incision, and then we inject some lidocaine into the anterior chamber. We then inject our viscoelastic with a dispersive injected first and then a cohesive that is targeted in the nasal angle. We then create our main incision using a 2.2 millimeter keratome. And then we tilt the microscope 30 to 40 degrees, turn the head of the patient away from the surgeon, and then we ask them to look straight ahead. We bring our gonio prism, and we see here the TrabEx, which is a trapezoidal design with serrated edges with two different blades, allowing to excise a strip of trabecular meshwork. And this trapezoidal design, as well as the serrated edges, allows for a smooth entry of the device into the canal. And we really don't have to change the angle of approach when we are creating our goniectomy, which is quite nice. We just oppose the TrabEx on the trabecular meshwork and then slide it in the direction that we're going. We can go completely opposite and go on the left side and then on the right side, allowing for about 90 degrees of goniectomy. And really I found it to be quite smooth in its entry, coming in and out of the canal. And it gives us a nice strip. And we're seeing here when we're going back within that area of excised trabecular meshwork, it's really a nice area that is devoid of any meshwork remaining. And then we examined our strip, which was quite nice and interesting to see the majority of the trabecular meshwork that has been removed. Then we go ahead and do our cataract surgery using a quick chop technique, which went quite uneventfully with a hemiflip here of the nucleus. We place our intraocular lens into the capsular bag. And we then start looking at if there's any flow from the nasal angle in the aqueous veins, which is one of the potential prognostic signs. And always when we're coming in and out of the eye, we're trying to maintain the anterior chamber with either balanced salt solution or some viscoelastic. And here when we're hydrating our incisions, we're seeing these aqueous veins blanch in that nasal angle at two different spots. And this is really something that we feel is a potential positive here for our patients. And this patient did quite well with pressures in the mid-teens and minimal heme postoperatively.